The geniculate ganglion receives fibers from the motor, sensory, and the parasympathetic components of the facial nerve, and it gives off the greater superficial petrosal nerve as well as the tympanic segment of the facial nerve. So the geniculate ganglion sends fibers that will innervate the following: the lacrimal glands, the submandibular glands, the sublingual glands, the tongue, the palate, the pharynx, the external auditory meatus, the stapedius muscle, the posterior belly of the digastric muscle, the stylohyoid muscle, and of course, the muscles of facial expression. It is the greater superficial petrosal nerve that carries parasympathetic preganglionic fibers from the facial nerve that synapse with the lacrimal gland, the mucosa of the nasal and palatine glands, as well as the pharynx. Let us now review the course of our facial nerve. So here we can see our facial nerve exiting at the pontomedullary junction along with the vestibulocochlear nerve. And together they enter into the internal auditory canal where our facial nerve is located anterosuperiorly. Our facial nerve then forms the geniculate ganglion, which gives off the greater superficial petrosal nerve and the main trunk of our facial nerve. The greater superficial petrosal nerve combines with a branch of the maxillary nerve, which is a branch of a trigeminal nerve, and form the Vidian nerve. So the Vidian nerve now is the one that innervates or gives off parasympathetic fibers, which innervates the lacrimal gland, the mucosa of the nose, pharynx, and the palate. The main trunk of the facial nerve gives off uh, the nerve to stapedius muscle, as well as the chorda tympani. Our chorda tympani combines with the lingual nerve, which is a branch also of a trigeminal nerve, and innervates on the anterior two-thirds of our tongue. Now, the main trunk of our facial nerve exits the mastoid area through the stylomastoid foramen. And then it is in the parotid gland where the facial nerve splits extensively and form its terminal branches, which now innervates the different muscles of facial expressions. The chorda tympani travels through the middle ear across the tympanic membrane and passes between the malleus and the incus. The chorda tympani emerges from the skull into the infratemporal fossa, where it combines with a branch of the trigeminal nerve, which is the lingual nerve. And these special sensory fibers provide taste sensation from the anterior two-thirds of the tongue. The facial nerve exits the cranium or the mastoid bone through the stylomastoid foramen, and it enters the parotid gland where it branches at the pes anserinus. So, pes anserinus refers to the main bifurcation of the facial nerve into the upper and lower branches, or temporofacial and cervicofacial respectively. From the pes anserinus, the facial nerve divides further into five major branches: the temporal, the zygomatic, the buccal, the marginal mandibular, and the cervical branches. Also take note that there is a posterior auricular branch which splits from the main trunk after it exits the stylomastoid foramen. Now, this posterior auricular branch innervates the occipitalis and the muscles at the postauricular areas. The temporal branches innervate the frontalis, orbicularis oculi, and the corrugator supercilii, while the zygomatic branches innervate the orbicularis oculi. The buccal branches innervates the orbicularis oris and the buccinator and the zygomaticus muscles, while the marginal mandibular branch innervates the mentalis muscle. The cervical branch innervates the platysma. This figure or illustration shows the different branches of the facial nerve and the organs or the areas that they innervate. Let us go now to the vascular supply of our facial nerve. Within the pons, the facial nucleus receives its blood supply primarily from the anterior inferior cerebellar artery or ICA. And ICA also enters the internal auditory canal with the facial nerve. The superficial petrosal branch of the middle meningeal artery supplies the extramedullary facial nerve, while the posterior auricular artery supplies the facial nerve at and distal to the stylomastoid foramen. The venous drainage parallels the arterious blood supply of the nerve. The facial nerve has sensory function in the palate and of the tongue, and it provides special taste sensation to the anterior two-thirds of the tongue. It has a secretory function of the lacrimal and salivary glands, as well as the mucosa of the nose and the pharynx. It provides motor innervation to the muscles of facial expression, the posterior belly of the gastric, the stylohyoid, and the stapedius muscles. Also to the occipitalis and the peri and postauricular muscles. The parasympathetic fiber of the facial nerve supplies many of the glands of the head and neck, which I had already mentioned a while ago. The muscles of facial expression is important because through their action, humans can be able to express their emotions. The muscles of facial expressions include the orbicularis oculi, which closes and squints the eye when one uh, winks. No? Another is the levator palpebrae superioris, which elevates the upper eyelid, and the corrugator supercilii, which draws the eyebrow inferomedially and shows anger and concern. The zygomaticus major draws the corner of the mouth upward and laterally when we smile or laugh, while the zygomaticus minor also draws the upper lip upward during smiling or when we show smugness. The risorius retracts the corner of our mouth when we grin, smile, and laugh. The levator labii superioris raises the upper lip and helps form the nasolabial furrow. Um, The levator labii superioris alachinasi raises the upper lip and opens the nostril. This is usually seen when we show anger or contempt. The levator anguli oris elevate the angle of the mouth when we smile or sneer or when we do the Dracula expression. The orbicularis oris closes the lips or protrudes the lips during puckering or when we whistle. The buccinator presses the cheek against teeth and compresses distended cheeks when we pucker or expresses a sigh. The platysma draws up the skin of the superior chest and neck. The depressor anguli oris or triangularis draws the corner of the mouth down and laterally when we show sadness. And the depressor labii inferioris also draws the lower lip downward and laterally when also we show sadness and uncertainty or dislike. The mentalis muscle raises and protrudes the lower lip as it wrinkles skin on the chin. So this happens when we pout or when we show disdain or doubt